Crown lengthening is necessary often from a functional standpoint when inadequate structure of the tooth is available above the gum line. So if a crown needs to be placed on a tooth because it's had a cavity, or perhaps part of the tooth was broken and it's decided that a crown is necessary to restore it to function, the judgment is, well, is there enough of the tooth left to be able to place a crown? And if the answer to that is no, then functional crown lengthening is a surgical procedure that can be performed to lengthen the available amount of tooth above the gum line. So incisions are made, and then the gum and the bone is essentially moved down to a level where, after healing, the tooth can be prepared for a crown and the crown can be placed and restore the patient's function. Now, from an aesthetic standpoint, crown lengthening typically involves a procedure in the front of the mouth for a patient that may present with what is called a gummy smile. So that means that when they smile, they see a disproportionate amount of pink or gum tissue relative to the teeth. So when a patient is referred for this, we have to do an analysis of their smile, and we have to determine from a diagnostic standpoint what the etiology or the cause of the gummy smile is. But more often than not, aesthetic crown lengthening, functional crown lengthening, implants, oftentimes patients have a variety of needs, and these procedures are done in concert with one another in many of our cases. So it's necessary to have a very thorough understanding of the aesthetic principles and the functional principles, because oftentimes we need to do a combination of procedures at one time on a given patient to achieve the desired result.